My name is Allison Snyder, and this presentation is on mindfulness-based stress reduction techniques and decreasing fatigue in cancer patients. So why is fatigue in cancer patients important, and why is this a current issue? According to Johns et al., 2014, fatigue is a highly prevalent and bothersome symptom for patients with cancer. Survivors have identified it as the most distressing and debilitating of all their symptoms in research. Yet, it is underreported in the clinic and is seldom diagnosed or treated. Approximately 14.5 million cancer survivors are currently living in the United States. This number is expected to rise to 19 million by the year 2024. Fatigue can lead to a negative quality of life for these individuals. Fatigue also continues long after chemotherapy and radiation treatment completes. According to Leswick, 2015, on page 277, fatigue is the longest lasting and most disruptive symptom that results from adjuvant chemotherapy treatment. This is why I decided to do my presentation on cancer-related fatigue and mindfulness-based stress reduction techniques. Many cancer patients are negatively impacted by fatigue and their quality of life suffers greatly. Fatigue is something that could be related to other issues as a result of cancer and cancer treatment, such as anemia and/or pain, but often there is no specific treatable cause for generalized fatigue. I believe that mindfulness-based stress reduction techniques can be greatly beneficial to patients and have the potential to help manage and treat fatigue in this vulnerable population, as there is currently no golden standard for treating cancer-related fatigue. The purpose of this presentation is to explore mindfulness-based stress reduction techniques and how effective they are in decreasing fatigue in patients diagnosed with cancer. The PICO question. P, the population is oncology patients. I, the intervention, is mindfulness-based stress reduction techniques. C, the comparison, is no intervention at all. And O, the outcome, is our mindfulness-based stress reduction techniques more effective than no intervention to help manage fatigue in oncology patients. For the literature search, EBSCOhost was utilized to search for relevant research articles. As you can see here, three main things were considered when conducting the search. First, keywords such as mindfulness, cancer, and fatigue were utilized. Next, results were limited to articles that were available in full text and were peer-reviewed. And lastly, a range of dates were selected between the years 2013 and 2018 in order to retrieve articles that were less than 5 years old. After search criteria was entered, articles were chosen based off of titles and abstract reviews and whether or not the information was pertinent to this evidence-based research project. It took some time to complete and review relevant research articles, but the EBSCO search engine and the articles that were provided through the search made the process easy to find quality articles. Literature synthesis. 4 out of 5 of the studies utilized mindfulness-based stress reduction techniques that included things such as yoga and meditation. However, one study did utilize mindfulness-based music therapy as their stress reduction technique. Both mindfulness-based stress reduction techniques and mindfulness-based music therapy did show to decrease fatigue. In fact, fatigue was seen to decrease the most out of all mood states studied by Leswick 2015 with mindfulness-based music therapy. Control groups were utilized in 4 out of 5 of the studies. This helps to strengthen the results and supports the PICO question for this presentation, which is to see if mindfulness-based stress reduction techniques are beneficial in decreasing fatigue in cancer patients when compared to no intervention at all. Research supports the PICO question by finding that most studies found improvement in fatigue when utilizing mindfulness-based stress reduction techniques. Johns et al. 2014 found that fatigue severity, days, and percent of days fatigued decreased. Bauer et al. 2015 also found a significant improvement in fatigue. Fatigue was also found to be stabilized and maintained at follow-up by Ramani and Telepasan 2015 and Langacker et al. 2016. Not only was a decrease in fatigue maintained, but Johns et al. 2014 also found that individuals were continuing to participate in mindfulness-based stress reduction techniques upon completion of the study or class. However, one study did find that results were not sustained during follow-up. Bauer et al. 2015 did not find that their results were maintained at follow-up, stating on page 1238 that it is unclear why participants in our study did not sustain the improvements in stress, depression, and other symptoms observed at post-treatment, although they did report improvements in cancer-specific distress at the follow-up assessment. One main difference to be significant was quality of life. Quality of life was found to improve in some studies, but not in others. Langacker et al. 2016 found no change between the experimental and control groups when it came to quality of life, but did find improvements in both fatigue as well as anxiety. These improvements in fatigue did agree with Ramani and Telepasan 2015, and both also found that the decrease in fatigue was stabilized and maintained during follow-up surveys. Reflection. Information was laid out in a table format in order to help organize and better synthesize the data. Comparisons were then made and similarities and differences were easily visible. The main challenge to this project was that a lot of the research, including the 5 articles that were chosen for this presentation, had small sample sizes. Only one study had over 100 participants. That was the Langacker et al. 2016 study. The rest of the studies had less than 100 participants. Recommendation for practice. So research supports mindfulness-based stress reduction techniques and mindfulness-based music therapy to help decrease fatigue in cancer patients. The study by Ramani and Telepasan 2015 on page 9 states that when implementing this program, pain symptoms and fatigue considerably decreased in patients compared to the baseline and the control group. Also, the findings of this study revealed that the group mindfulness-based stress reduction program improved the overall life quality functions in patients with cancer. Another article that supports a change in practice is Johns et al. 2014, stating that mindfulness-based stress reduction participants demonstrated significantly greater improvements in fatigue interference than waitlist controls, and improvements in all symptoms were maintained for at least 6 months beyond the completion of the mindfulness-based stress reduction course. Barriers to mindfulness-based stress reduction techniques. 2 of the main barriers could be transportation and cost. Transportation could be a barrier, as some people may have trouble getting to and from appointments as it is already, and therefore may not have a way to get to mindfulness-based stress reduction classes. Costs could also be an issue, as with any class, there is a cost to participate. A fix to both of these issues could be at-home mindfulness-based stress reduction. Individuals could be trained and educated on these techniques and be able to perform them at home at their own convenience, and no cost to them. Key points to take away is that there is no golden standard for the treatment of fatigue in cancer patients. Mindfulness-based stress reduction techniques include yoga, meditation, and music therapy. These techniques are relaxing and do not involve a lot of physical activity, especially music therapy. Mindfulness-based stress reduction and mindfulness-based music therapy have been successful in reducing cancer-related fatigue, and results can be long-lasting, especially when mindfulness-based stress reduction techniques continue. And here are the references. Thank you.